Joining us now, member of the Senate Foreign Relations and Judiciary Committees, Democratic Senator Chris Coons. He is backing Joe Biden for president. And, Senator, I want to talk to you about what Joe Biden's leadership would look like right now. But first, let's get to what's happening today. Do you think we will come to something that will bring relief to Americans?
Mika, I'm very optimistic that there will be a deal announced this morning. I just spoke to Senator Schumer. He and Secretary Mnuchin had very productive negotiations last night, and he spoke to President Trump. So I am optimistic that the three big issues that caused Democrats to stand against this deal over the last 2 days have been addressed. First is that there is a $500 billion fund for bailing out large corporations without transparency or accountability. Second was there wasn't significant investment in our hospitals, in our public health system, to support the men and women who today are out there on the front lines working so hard to keep people healthy and to care for those who are sick. And third, there wasn't significant support for state and local governments. As you know, Mika, I ran a county government for a number of years, and an awful lot of the frontline folks we count on to care for us, whether they're paramedics or orderlies or nurses in county hospitals, those are public employees. So all three of those core issues, there's been real progress on overnight. And I think there's lots of other extraneous issues that Republicans tried to put in the bill, that some of my colleagues are trying to put in the bill. We need to let our leadership come to an agreement and move it forward today. I've heard from Delawareans up and down my state in the last 2 days. They want the unemployment insurance relief. They want the grants to small businesses and nonprofits to help keep them open, keep people on payroll. They want the individual payments. There's a lot of angst and a lot of pain out there, and the federal government, Congress in particular, needs to come together and get this job done. I think we can, and I think we can today.
We'll get to those extraneous issues in a second. But one thing Joe Biden said as we were coming in, that 1,000 things need to be done at the same time to sort of deal with this crisis of the coronavirus. One big issue is the election process. Are you concerned it will be disrupted? And what can be done to make sure the elections happen on time and sort of the sanctity of the voters who intend to take part in it is kept intact?
Well, Mika, this is one of those issues where I view it as central, and some of my colleagues have said this is not essential. I think we should make it possible for every state in America to vote by mail, given that we've had 6 very significant states already defer their presidential primaries. There is a real risk that the primaries will get pushed back, and that the general election in November will have to take place under an ongoing cloud. So there are some states like Colorado that already mail a secure ballot to every registered voter. I've got a bill that's being led by Senators Klobuchar and Wyden that I've joined, where I'm supporting the funding for it, that would require every state to make provisions for vote by mail and for 20 days of early voting. Look, Mika, we managed to have our troops vote in the height of the Civil War and the Second World War. We ought to make provision for the Senate to be able to vote if we all have to go back to our homes and shelter in place, and for the American people to be able to vote. It's a fundamental constitutional right that I think we should be addressing.
Senator, it's Jonathan Lemire. Yesterday, we heard the president say more than once that he is considering reopening at least part of the nation and the nation's economy at the end of this 15-day trial period, which will be over in about a week or so, suggesting that, there are some states, California, New York, Washington, others that are hotspots and would remain likely isolated, but other parts of the country, less impacted, could start to reopen. You represent one of the states that's not one of the pure hotspots of this. What is your take on this proposal? What do you make of this push to sort of reopen the economy of the nation against the advice of many of the president's own health experts?
First, one of the most important things in public leadership is to know what you don't know. As a senator, as a county executive, I relied upon the professionals, the experts. I've been on the phone repeatedly in recent days with our own Director of Public Health, our Secretary of Health and Social Services in Delaware, and with folks who are currently and formerly in leadership in CDC, in FEMA, and NIH. Dr. Fauci and Dr. Birx are seasoned, nonpartisan, professional epidemiologists, and public health leaders. We should only be having a conversation about loosening restrictions on people's movement and reopening the economy when our public health experts say it's time to do so. Countries in other parts of the world, like South Korea, succeeded in handling this virus quickly by scaling up testing and getting to massive amounts of testing, and by managing their expectations of the public and the economy, and then having some loosening and reopening, not the other way around. Decisions here shouldn't be driven by political or partisan interests, by economic interests. We have a lot of people anxious and nervous about their children, about their health, with loved ones in the hospital. We need to listen to public health experts first.
Senator, we know from what is happening in Italy, and now we've seen the big shutdowns in the UK as well, that the health systems are about to be hit here in the United States. Can you give us some insight into what is happening into your hospitals in Delaware? What do they need in terms of equipment? What are they missing? And would using the Defense Production Act and getting American companies to focus on the production of masks, of gowns and of ventilators help your hospitals?
Yes. Like many hospitals around the country, they have a looming shortage of testing capacity, of personal protective equipment, and of ventilators. They are not today experiencing a critical shortage, but as you said, given what the projections are for how many cases are going to come into the ERs, what I've heard from the head of our largest hospital system, who I've been communicating with several times a day, is that they are bracing for a concerning lack of that equipment. So I've also been on the phone with a number of our local companies that are involved in diagnostic equipment, in a chemical assay, in the provision of PPE. Our governor, John Carney, has been doing a tremendous job. We're coordinating, for example, with construction companies to get them to donate some of their N95 masks, with some of our university resources to help with more reagent for a high-speed testing equipment that Roche has, but that we've run out of the ability to run tests on at our main hospital. We also have to be mindful of our rural hospitals and our Medicare-dependent hospitals. That's a big part of the deal that Senator Schumer has worked so hard to secure, and Senator Murray has played a decisive role, is getting in this package that I hope will move forward today a big support for our public hospitals, frankly, our entire hospital system.
Senator Chris Coons, thank you very much for coming on this morning. And coming up, we know New York is at the epicenter of America's coronavirus outbreak. We'll talk to Congressman Max Rose about how the city is responding. Morning Joe is coming right back.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.